Hello, I am Alyssa Otani Cole. I am a program specialist with Opportunities for Ohioans with Disabilities. In this training, I am joined by Tom Hess from the Department of Developmental Disabilities and Olivia Hook from the Ohio Department of Transportation. This course was developed from an in-person training that we did, and based on the interest and feedback we received from that training, we wanted to bring it to you as a resource. Before we begin, we want you to know that this presentation on transportation does not have all the answers, but regardless of whether you started working 20 years ago or 20 days ago, we want to be able to share resources on how to collaborate and resources that can be possible solutions regarding transportation. In this training, we are going to give a high-level overview regarding Ohio Employment First and an overview of the foundational information of each system. We are going to give an overview for each state department that's a part of this transportation training, so Ohio Department of Transportation, Opportunities for Ohioans with Disabilities, and Department of Developmental Disabilities. We're going to use this overview to understand our systems from a person-centered perspective and follow individuals as they learn to access the community. And we're going to get to know local resources and partners through ongoing conversations so that we can best support the individuals we're working with. Ohio Employment First Initiative is an executive order that was signed in March of 2012. Based on this executive order, there was a task force that was created, and this task force is charged with expanding community employment opportunities by reducing barriers and aligning state policy. Part of this task force is the Ohio Department of Education, ODE, Ohio Department of Developmental Disabilities, DODD, Opportunities for Ohioans with Disabilities, OOD, Ohio Department of Mental Health and Addiction Services, ODMHAS, Ohio Department of Job and Family Services, ODJFS, and the Office of Medicaid Services. As part of the Ohio Employment First initiative, there is the Ohio Employment First partnership between Opportunities for Ohioans with Disabilities and the Department of Developmental Disabilities. And as part of this partnership, we use foundational principles. These are agency neutral, person-centered, and outcome-focused. Agency neutral is coming together as a team to support an individual in an agency neutral way, where we are looking at what the person's interests are, what their needs are, and talking about that collaboratively. We are also person-centered in how we do this. So what is it that the individual is needing? What is it that they are interested in? What are they looking to achieve? So being outcome-focused in how we do that. All of our services and our supports to that individual should be based on their outcomes, and we will do it in that agency-neutral way. As we work with individuals on their road to community, there is not one single solution for transportation and not one single pathway to community that works for everyone. Because each person's journey and their path is unique to them, it must be based on their individual preferences, their interests, needs, skills, and strengths. And because of that, their transportation needs and resources are also going to be unique and should be addressed by person-centered planning and throughout their entire journey. A resource that will be available to you is the State Employment Leadership Network Guide, so the SELN Guide. The State Employment Leadership Network Guide helps to identify and design pathways towards rewarding community engagement. This SELN Guide looks at the path that each individual can take. So the role of the case manager, how we will start the conversations, how focusing on the destination will help identify transportation options, which can also lead to career success. An overview of the state agencies that develop this training is OOD, Opportunities for Ohioans with Disabilities, which is the State of Ohio agency that partners with Ohioans with disabilities to achieve quality employment and independence. They are also the agency charged with making determinations on Social Security disability. The Department of Developmental Disabilities offers support across the lifespan of people with developmental disabilities and oversees a statewide system of supportive services that focus on assuring health and safety, supporting access to community participation, and increasing opportunities for meaningful employment. For the Ohio Department of Transportation, the Ohio Mobility Management Program increases access to mobility for Ohioans by increasing understanding and awareness of transportation needs, coordination of transportation options to meet needs, and building sustainable and healthy communities by integrating transportation into planning and programs.
Hi, my name is Olivia Hook. I'm with the Ohio Department of Transportation. I am the statewide mobility coordinator at the Office of Transit. The Office of Transit at ODOT is just a little different than a lot of the other departments we have within ODOT. Typically, when you think of ODOT, you're thinking of constructions, roadways. When you come to the Office of Transit, we're looking at human service transportations, how individuals get from point A to point B, and we do a lot of pass-through federal funds that come through. Those will fund public transit in addition to human service transportation for nonprofit. When it comes to getting individuals around from where they are to where they need to be, you've got Ohio, which is a wide variety of urban and rural areas. You can go from a large urban area of Cleveland, and within an hour you're in Amish country, which is very rural Ohio. Because of this diverse landscape in Ohio, understanding how to help individuals get around, I think it's really important to understand why the different types of funding and the different types of transportation that is offered in Ohio, and just understand the background of it so that for the planning purposes, we can understand exactly what boundaries and what limitations that we currently have. When you look at federal funding from the FTA, the Federal Transit Administration allocates funds directly to the large metropolitan planning organizations for the large MPO areas. That would be Cleveland, Toledo, Cincinnati. When you look at the small counties and the small urban counties in Ohio, that is where the Federal Transit Administration allocates funds directly to ODOT to manage. So when it comes to you're looking for transportation options, understanding the funding and how that works, because there's a lot of limitations to the service area that the providers can provide that transportation service because of that jurisdiction. So if an MPO is receiving an allocation for large urban areas, that funding is focused on the large urban areas and should stay there for that reason. And there's funding allocations that go to ODOT that is designated for rural and small urban areas, and that's where that money and that funding should stay, and that's why those transportation providers stick within those boundary lines. There are different types of funding when it comes to transportation and just federal grants in general. There's local match, which typically there's a local match requirement whenever there's Federal Transit Administration funds. We have flex funds, which might be funding that was transferred from another program to this program. There's federal funds, and then there's state funds. When it comes to providing transportation, and a lot of the times the biggest barrier is going across county lines, and a lot of times trying to understand a lot of the background of why the transportation systems can't cross county lines, and a lot of times it has to do with the funding. There's certain limitations. If there's local match being used, those local match dollars need to stay local, so providing that transportation out of county becomes very complicated. If there's an allocation that is to a specific county, taking that into another county, it gets very complex. Understanding these considerations while you're looking into transportation options is just something good to understand, because as you dive deeper, you're going to ask questions that this might actually answer. When you look at the ODOT Office of Transit, we offer not only the grant authority and oversight for those transportation grant dollars, but we also offer safety oversight, resources, technical assistance. We work with a public safety plan. We're always providing information and studies about what the impact of what's going on in Ohio and how things can look in the future. Another thing when it comes to transportation in Ohio, when it comes to public transit, there are different types of programs. There's different types of buses that you can get on, and just understanding exactly what's available out there is very helpful when you're trying to determine what would be the best route to use. The first one would be 5307. That is Large Urban Transit Program. When you go into the large urbanized areas, you'll typically see our Regional Transit Authority, which is abbreviated to RTA. Typically that is the 5307 Large Urban Transit System program. 5310 is another program that is offered for transit in Ohio. That is specialized transportation program for persons with disabilities and seniors. Those are accessible vehicles that you typically will see, and those are vehicles, and this program is for that demographic. 5311 is a rural transit program very similar to 5307, but just in the rural areas in Ohio. That program and that service is available to everyone in the general public. The Rural Intercity Bus Program is another program that we manage in our Department of Transit. And the last program I wanted to share is mobility management. And I'll go into that a little bit more later. But the one difference that mobility management has than the other four above it is that the four above it is transportation service centered. It's centered around providing the vehicles. The mobility management part is person centered. It's centered around the individual.